Five on Your Side is partnered with Washington University to help answer questions you have about coronavirus. And joining us once again, Dr. Jason Newland, an infectious disease specialist. And doctor, let's get right to the viewer questions. Here's one. I tested positive for COVID-19. Do I need to be retested after my quarantine period to know that I'm not positive anymore?
So great question. I think everybody's wondering about this and when they're, safe to be around others. If you're a healthcare worker, your occupational health and those individuals will help you decide what happens next. CDC would recommend, especially for healthcare workers, that you would have 2 negative tests. Now, as we know, we don't have all the potential supplies we need to do all of this testing. So for people like yourself who maybe aren't in healthcare, we want to make sure that number one, your symptoms have resolved. Number two, you haven't had a fever for over 72 hours. And that's with not being on like Tylenol or ibuprofen. And it's been at least 7 days from the start of your symptoms. I think most people are being even more careful and saying they're going to wait a total of 14 days to make sure that they're healthy. And that means from the beginning of the symptoms. So again, I would reiterate, you want to make sure you're not having symptoms. You haven't had a fever. And you can always talk, if you're in healthcare, with your occupational health experts.
Here's another question, doctor. I have to go for routine blood work. Should I be concerned about being so close to the technician or sitting in the chair?
I think it's safe if we take the right precautions. And lastly, because these people are really good at drawing your blood, I'm sure it's a very quick interaction. So I think that will also limit your time and your exposure.
Dr. Newland, we're short on time. Thanks very much once again for joining us. If you have a question for the doctor, text, don't call. That's 444-5125, 444-5125.